We all know that in America we're seeing an explosion of certain types of disorders, and the more chronic disorders are the ones that are going through the roof, right? Two of them right now that are more likely to increase are the cardiovascular disease and the mental health disorders. And we, especially since COVID, we've seen an explosion in these two, and both of them are linked. And part of it to blame is, spent more time at home, so people didn't go to the gym or different things like that. They changed the way that they ate. There's a lot of different factors that go into this, so I'm not going to say it's one factor or another, but I want to dive into this for a minute because the people that have those issues, whether it's cardiovascular disease, whether it's mental disorders, whether it's both, they end up with increased time in the hospital, right? There's a lot more hospitalization in those populations. They end up with poor health outcomes. They end up with poor quality of life. They increase the risk of death, premature death. So there's a lot of different things that we see that decrease their quality of life. And not only is it a tax on lifespan and the quality of your life, it's also a tax on your finances. When we look at cardiovascular diseases, research shows between 1 million and 4.8 million. I usually use the statistic of 1 to 2 million because that is some of the more midline data, but some of them show up to $4.8 million in lifetime expense from cardiovascular disease. Mental health disorders, depending on the type you have, depending on the severity, we're looking anywhere up to $1.85 million for the lifetime cost of a mental health challenge. And so it's not just a tax on you and your quality of life, it's also a tax on your finances too. But a recent study came out by Majan, and it was done basically looking at the amount of inflammation in the diet and the risk of cardiometabolic disorders and mental health disorders. And what they did is they found out that the higher the inflammation load in the diet, the higher the likelihood of cardiometabolic or I think they looked at both in this, but mental health disorders as well. So we saw a linear progression. The more inflammation in the diet, the more likely they were to have the diagnosis of that later on. What they're suggesting is a small decrease in inflammatory load in your diet can greatly reduce your risk of having these problems. Now, one of the things that they looked at here was it's done in India, right? So they say that one of the biggest problems was some of this was done in rural India, and they said that people don't understand the dietary things as well. And I'm going to say that this isn't just a thing in India, right? There's a lot of people right here in the US that are being tricked by marketers. They're being told that things that are not health food are health food. They're being tricked to think that things that they're eating are better for them than they really are. But there's a lot of confusion no matter what. Even if you know what you're doing, it's hard to find exactly what you need to know. You need to know the baseline information. You need to know the types of ingredients to look for. Because when you're just looking at the macros, when you're just looking at the fat, the protein, the carbohydrates, it doesn't give you as much information as it likely should. You gotta look at those ingredients and see what's in there. So when we look at the standard American diet, we know that it's a high inflammatory load. But even those people that are getting a better quality diet, there's still a lot of things in there that are creating inflammation and leading down these pathways. So what can you take out of this? If you can improve your inflammatory load just a little bit by what you're putting in your mouth, it's worth the while. You're going to reduce your risk of cardiometabolic disorders. You're going to reduce your risk of mental health challenges. And both of those are going to increase the quality of your life, right? It's going to decrease the rate of hospitalizations. It's going to decrease the rate of early death. It's going to decrease it's going to increase the quality of life, rather. It's going to decrease your financial burden as well. Like I said, cardiovascular disease, $1 to $4.8 million lifetime costs on cardiovascular disorders. When we look at mental health disorders, anywhere up to $1.85 million. If you're looking at diabetes, it's 1 out of every 4 of our healthcare dollars right now are spent on diabetes care. Think about that. If you are scared of where the healthcare system is going and where our financial system is going, look at the cost of diabetes care. It is through the roof. So just look at your diet. What are your blind spots? What do you know? What do you not know? And these are things that we can have a conversation about. So I love you. I appreciate you. I know that your time and attention are valuable, and I appreciate you spending some of it with me. I'll look forward to catching you on the next video.